Welcome to another edition of Learning to See, Seeing to Learn with Dr. Patrick Quaid and Cari Fairley. Dr. Quaid is the founder of the View Cubed Vision Therapy Centers. They're located in Guelph and North York, Ontario. Cari was a teacher for more than 30 years in Ontario as well, in 3 different school boards. Now recently retired. Congratulations, Cari.
Thank you.
One of the things we want to talk about today is looking at the progress that you make when a student is struggling. You recognize the learning is not going as it should. What kinds of steps do teachers typically take to review where the student's at and help them move forward when it comes to that checklist that you often use?
Well, most of my career has been focused around that very thing, is literacy, reading and writing. And when children were having difficulties, the first easy thing that the teachers do is kind of like a little checklist in your head. The very first thing we do is say, get their eyes tested, take them to the doctor, get their eyes tested if they need glasses, get their ears tested. Sometimes we discover a slight hearing issue that would distract a child and change things. Once we get that, then we know we've sort of, or nutritional, even allergies. Sometimes they'll do that, and then we've covered sort of the medical side of things. Then when the child comes back with their glasses and they're still having problems, then at least we can say, we need to delve into this. We need to delve into this farther. Often we then start doing testing in school. We've got various consultants and specialists that would come in to talk to the child, do some testing as far as literacy, reading, all of that kind of thing. And often then they would start into small groups, not only in the classroom with the teacher, with other kids that may have some similar issues, but they'll also be taken out of the classroom to meet with an LST teacher, which is learning support.
Dr. Quaid, from your experience, you've encountered many kids who've struggled, and even after getting their glasses, it's still a problem. Talk about the kind of therapy you do and the kind of diagnostics that you're able to use to help children to move forward in their education.
Yeah, and I think it's important to state that, a routine eye examination is perfectly fine for a routine child who's not having learning issues or concussion, for example. That's a whole other arena that we can talk about. But when you have a child who's got an IEP or an individualized educational plan in place, who's specifically struggling with spelling, reading, tracking, a lot of these kids will have difficulty copying work from the page quickly. That's one thing that we hear a lot from our parents. I'm sure Cari, she's nodding her head. She hears that a lot from parents, that copying speed's reduced. We tend to do a little bit of a deeper dive. And when you look at the visual system, the routine eye examination or the screening is usually designed to, pick up a prescription if there is one, check for any eye disease or any really obvious eye teaming issues. But there's a lot of subtle eye teaming issues and near-far focusing issues and tracking issues that can be a problem that can very easily be missed in that routine assessment. And I think in the paper that we published in 2013 in a medical journal, the conclusion of that research, which looked at 50 kids aged 6 to 16 with IEPs versus controls, the conclusion of that paper, which was supported by the research, basically came to the conclusion to say, look, yeah, if you have a kid who's got an IEP in place, there's probably an 82 to 84% chance that they have an eye teaming issue. And those can be subtle. So you need a more in-depth assessment.
Why don't you explain eye teaming to us?
Sure. Well, probably a good way to make that analogy is if I'm driving a car and my wheels in my car are aligned, I can probably have the radio on, somebody sitting beside me, I can have a chat to them. It's not very hard to control the vehicle. If the wheels in the car go slightly out of alignment, I can still control the vehicle, but I have to work harder to control it. So the first thing I'm probably going to do is turn off the radio. The second thing I'm going to do is tell the person beside me to be quiet, because I have to put more effort into controlling the vehicle. So that's a good analogy for if my eyes are not working together. When I read, I have to work a lot more. If I'm copying stuff down from the board, it can be excruciatingly difficult for these kids to do. And they can often look like they're not attending or they're not paying, because most kids will just say, I'm not doing this anymore. This is too much work. And they'll look like they're getting distracted. Or, I've had kids who've quite honestly seen double. So when they look at the page, they see 2 of things, but in their mind, because they've never seen differently, they think it's normal. In fact, I had one kid when I asked, when we found that he was seeing double, and he finally came out and said, yeah, I see 2 of things. I remember the mom and the dad in the consulting room saying, well, why didn't you tell us? And the answer he gave was classic. He said, well, I looked over at my friend's page and his page was double two. So I just assumed everybody sees that way. And, you know, the innocence of that from a child. So I think when, and the kicker is you cover one eye, I'm 20/20, I'm 20/20. So, you know, just because I can see size 20 font 20 feet away doesn't really have any bearing on how my eyes move when I'm reading. So to your point, Grant, about the glasses, you know, glasses are useful in terms of making text that's blurry clearer, but glasses don't determine how your eyes move. Your brain determines how your eyes move, right? So if I'm able to converge my eyes or cross my eyes, that's my brain doing that, right? And if I'm really good at that, I can cross my eyes, I can look at the left image and I can make the left image move. I can bring it back. I can look at the other image and I can make the other image move, right? So I can move one eye. So it's my brain doing that, not the glasses. So what vision therapy is getting at is basically trying to teach the patient how to gain control of their visual system. So really it's brain-eye teaming is what we're working on, not necessarily glasses. Not that glasses aren't important. They are in some cases, and they can be very, very useful. But it's the glasses should be viewed like a crutch. I mean, if somebody had a broken leg, you wouldn't give them a crutch and say, have a nice life. You'd fix the broken leg, you'd let them use the crutch, send them for a physio to try to get the strength back up and then get rid of the crutch. So vision therapy should be viewed in a similar way.
Well, when you were talking about the copying down off of the board, I mean, that as teachers, we kind of see that as a skill. Mm-hmm. So that is something that we have to encourage them to do, not realizing that for some of these kids, we're torturing them. The most dramatic example I have of that, and even with 25 years experience, I had never seen anything like it. I had a child come late to class and I had 9 math questions. So it didn't matter if it was writing or numbers or whatever it was. It was the idea that he had to copy it off the board into his book. I had even put 1, 2, 3, 4, 5, 6, 7, 8, 9, thinking, obviously you assume he's just going to copy it down in that order. I thought, well, if they make a mistake, he didn't notice the numbers, he might go down vertically. It took me an hour after school to figure out what he actually did in his book. I took his book and I took what was on the board and I numbered in a different whiteboard, like a red marker or like whiteboard, how he put it down. And I put like a 1 here and a 2 here and a 3 here and a 4 there. And then I took a green, a third color, and I literally connected them. And he had gone zigzag all over the place. I was bringing teachers in from the hallway to say, you have got to see this. This was how he interpreted, or his brain interpreted what he saw on the board, to me as a simple grid of 9 questions. He put the numbers down right and everything. It was how he picked them out, and they literally were all over the place. It was,
and I think what you have to realize about those kids, a lot of those kids will develop almost a sort of a tunnel vision, where they'll use so much effort to focus in on the question, they literally lose, almost like the Where's Waldo effect. Everything just gets mixed up on them. And you'll often find these kids, the same kids will get overwhelmed by print on a page, because it's, if you think about reading, it's a figure ground task, which means, you know, it's a Where's Waldo exercise. Here's a word buried amongst a whole bunch of other words. And that's a similar reason why these kids have tracking issues when they're reading, because they literally hone in on that. They're putting so much effort on that one thing they're looking at, they literally block out everything in the periphery. So that doesn't shock me at all.
And I had a lot of kids with reading that would jump lines, and then they would end up going back, and like it really was jumping all over the place. I had this one little tool that I would use. It was like a little strip, and it would cover the top and the bottom line, and it would be yellow in the middle, so that they could just see that line that they were reading. But it always fascinated me as to what are they seeing and how is the brain interpreting that.
Yeah, and I think in the study that we published in 2013, we also had a goggle where there was 4 infrared cameras on the inside. So we actually recorded these kids in real time while they read, and it showed very much the same type of pattern.
It's fascinating.
Yeah.
Well, this has been great. Thank you both for your contributions, some ideas here. There's so much more to learn about all of this from not only Dr. Quaid, but also Cari and the other contributors who've made this book something that's a great resource for both parents and teachers and other professionals who are looking at how children learn and the impact of that on their future careers, on their self-esteem, on their happiness, on their success in life. We've been talking to Cari Fairley, a retired teacher in Ontario, and Dr. Patrick Quaid, the author of the book, Learning to See, Seeing to Learn. Join us again for another episode when we come back.
Thank you.
Thank you.